National effort by health agencies known as contact tracing depends on an army of volunteers, according to CDC. An area health center attempts to explain in this morning's Newsmaker, brought to you by Warrensburg Chrysler. With more, here is Taya White.
If you are someone who has or knows someone who has tested positive for COVID-19, then you know that the next steps you need to take are quarantining and contact tracing. Carroll County Health Department Administrator Bertie Hartwig explains the process.
When we receive a positive notification, we reach out to that person and talk to them, of course, about their symptoms and where they've been. We also, with our contact tracing of that person, we ask for any contacts that they've been around in the time period that we're looking at. They give us the names, hopefully, of everyone they've been around, and we contact each of those names and talk to them about being quarantined and what that means.
Contact tracing is a time-consuming process that likely takes up most of the day at your local health center. It is also likely that only about 2 or 3 people are making these phone calls. Hartwig says that in Carroll County, this is a daily process.
Some positive cases may only have a couple contacts. Some may have 10. It depends on each case how many people we have to call. This is 7 days a week because we still receive notifications on weekends. So on weekends as well, we're calling people. At nights, we're calling people when we get notifications that come in at night. So this is an ongoing process.
Because of the time commitment, health departments are outsourcing help. Pettis County Health Center has a former administrator offering assistance. When Carroll County started to see a spike at an alarming rate, a dedicated deputy was assigned to help. However, the health department hasn't had the chance to appropriately use them. According to Johnson County Community Health Services Community Outreach Director Carrie Lewis, volunteers in Johnson County are donating their time to help contact trace.
We have some that maybe have retired from nursing but have given their time to come in and make those calls. And then others who do work here locally who maybe have some extra time outside of their schedule to be able to come in and dedicate some time for us as well. So it's been very, very helpful.
Contact tracing is a partial way to understand where the virus is coming from in the county. Pettis County Health Center Administrator Joanne Martin says the tracing process has helped detect some of the origins of cases.
We have been able to do some linkages to trace back where people either we're pretty sure that's where they got it or we have a strong suspicion that's where they came in contact with the virus. So it has been a worthwhile endeavor, and the more people are honest with us, the better our tracing becomes.
A small issue that has come with the tracing process is people becoming reluctant to disclose their information. Hartwig has experienced this problem in Carroll County. However, more times than not, people are willing to cooperate.
Some people choose not to give us their contact information. They don't want their friends to be quarantined, or they don't want them to think badly of them. I don't know what the reasoning is. So I know on some of them we're not getting all the contact. For the most part, most of our people do pretty well.
Knowing your symptoms is important to ensure that the tracing process is effective. For this to fully help stop the spread of COVID-19, it is important that you are educated on when you should quarantine and when you should get tested. Greg Miller, a family physician at Hedrick Medical Center in Chillicothe, talks about the symptoms you should be aware of before thinking of getting tested.
It really has such a broad spectrum of symptoms that it's difficult to characterize. But as far as people being concerned to be seen, would definitely recommend calling your primary care provider should you have fevers, cough, shortness of breath, loss of taste or smell.
Despite any recent spikes, Lewis and Hartwig are both hopeful that numbers can slow down and encourage all communities to take the appropriate precautions to help slow the spread.
We just really need to get this thing slowed down. I want to see kids going back to school. I want to see us getting back to a little bit of normal in our society and in our communities. So it's going to take everyone to make that happen. So just stay diligent, stay safe, and we're going to get through this.
For KMZU, I'm Taya White.